if you look at the slide as described by Gavi and Hazard in the year of 2013, for the acute groin pain in athletes, they claim that the combination of rest and physiotherapy along with local anesthetic and corticosteroids injections has effects. But if you look at the description of physical therapy, it does not have a clear picture, and then definitely we won't be able to use it in our clinic. So physiotherapy, it's a general term. Like, so what physiotherapy includes? So it does not have a clear description. So what we need to do is, like, the protocol name is Holmich protocol in the year of 1999, and then which has got best descriptions. And then, so if you look at the previous slides, it simply represent as a physiotherapy. It's very difficult, and then we were not able to replicate in the clinic setups. Whereas Holmich protocol, it includes so both it includes exercises for both abdominal as well as adductor, and then for athletes who has a groin pain. So the player who has a groin pain, the first 2 weeks they focus more on adductor as well as abdominal exercises, whereas after 2 weeks the player who has got the groin pain, they are able to do all the abdominal exercises, adductor exercises, coordination exercises. So the Holmich protocol has efficacy in reducing the groin pain in athletes. As we discussed earlier, so there are systemic reviews that, like, in the year of 2099 and then 2011, as described by Weir et al., the supervised exercise program has got much more effects than the home exercise program as well as the multimodal program, because the multimodal as well as the home exercise program has got the lower successive rate. So, and then although it takes less time, but the successive rate is less when you compare with the Holmich et al. So the Holmich protocol, it's been served as a supervised exercise program. It has got 79% RTS rate. So though it takes several more weeks than the other two programs. So what I would like to tell you is, like, we need to prioritize our focus when you have a groin. So when you have athletes with a groin pain. So what do you mean by prioritization? So the prioritizations, it includes pain management, mechanotherapy, tissue capacity, and indirect load adjustments, and then psychological factors, sport specific injury risk factors, performance or maintenance, and other adjuncts. So now let's look at one by one. So how do we manage the pain in athletes? So when you have a athlete with the groin pain, so prioritize your focus. What do you mean by prioritize your focus? So it's a purely criteria based. So, like, so once if it becomes a criteria based, so the program will have more efficacy, and then it helps to reduce the pain among the athletes who has a groin pain. So always we have to prioritize. So we have to be focused on developing a rehabilitation protocol to reduce the pain. So when we prioritize your time, and if we do that continuously, so we can get the better results. So when you talk about the pain management, pain management by analgesics, manual treatment, and compression shots, and then so the mechanotherapy, the tissue capacity, the capacity of the tissue following injury. So the load, so optimal loading, and then like, so indirect load adjustments. Yes, like, so not only on the site of pain, also we have to focus more on lumbo-pelvic strength and stability. And if you look at the psychological factors, so as a physiotherapist, we spend time talking to athletes and others, such as uncertainty in diagnosis and prognosis. And if it is sport specific injury risk factors, like, so like we need to include the exercises called eccentric strengthening program for the hamstrings. And if you talk about performance and maintenance, yes, of course, it's our responsibility to focus also on the cardiovascular fitness. And other adjuncts and placebo like kinesiotape, ultrasound, and other electrotherapy modality. So what do you mean by the mechanobiological exercise descriptors as described by Taigo and then Boutelier in the year of 2016? So as we discussed in the previous slides, the Holmic protocol, like the number of sets and the repetitions. So also like we have to manage the load, and then the exercises that we designed by a physiotherapist has to be decided. The exercises, how many number of repetitions and then sets to be implemented, and then so how do you offer the rest period between the sets of exercises. And then it depends like how many number of sessions that you are going to have with the patients. Are you going to ask the patient to do exercises how many hours per day or a week? And then so also one of the factor called range of movements. And then we also going to do the time under tensions. And then we also look at the quality of the contractions, whether the muscle has a poor contractions, inhibitions, or overactivating of a muscle. And then also depends on the level of pain acceptance of the athlete. Like, so during the load management, how the patient is able to accept the pain by doing a VAS score. So this is how you have to prioritize. And when you talk about effectiveness, not so though it's lost, but not the least. So when you talk about adductor strengthening program, so the Copenhagen has got much more effectiveness in reducing groin pain in athletes. So like what are the findings? So if you look at the findings, the adductor strengthening program based on one single exercises with the different progress levels from it reduced the prevalence and risk of groin problems in male football players by 41%. And how might it impact on clinical practice in the future? The adductor strengthening program should be implemented as a part of normal football training, along with FIFA 11 Plus, as we discussed in the earlier classes. So then here what I would like to say is the take-home message is overall evidence is poor. Still exercises seems to work. So we need to prioritize our treatment consciously, and then we need to work hard in then making the protocol for athletes who has a groin pain, and then consider adjustable variables in your exercise program, because we need to reassess so as per the pain score, and then you'll be able to progress the exercises. So that's the take-home message. And I would like to thank Mr. Andreas Cerner, because when I was preparing for the groin injuries for your classes, like, so it's really impressed to talk by Andreas Cerner in the Aspitor. So I would like to thank him a lot, because all the information whatever I have provided, so with his guidance, and then all the information has taken from Andreas Cerner thesis topic, because he's a groin specialist in Aspitor. So I requested his PhD thesis. So as an interest, I have requested him, and then he replied back with his PhD thesis. I also would like to share it with you. And then again, I would like to thank him, because I've learned a lot during the classes. I've got a lot of evidences, a lot of articles, and then a lot of papers on groin injuries. Even I've learned a lot about groin anatomy. And thank you so much.